10 early signs your heart isn't working properly. Most people believe a failing heart always announces itself with a dramatic chest pain, the kind you see in movies, someone clutching their chest and collapsing without warning. But that is rarely how it actually begins. In real life, the heart often sends out quiet, easy to dismiss signals months or even years before anything serious happens, and most of those signals get blamed on stress, aging, or simply being tired. This video is for educational purposes only and is not intended to diagnose any condition or replace the advice of a qualified healthcare professional. If anything you hear today sounds familiar, please consider speaking with a doctor who can properly evaluate your individual situation. Over the next few minutes, we're going to walk through 10 of these early warning signs, starting with the ones that are the most commonly overlooked. Some of them will surprise you because they don't feel like heart problems at all. In fact, one of the signs we'll cover later in this video is so easy to miss that many people mention it to their doctor almost as an afterthought, unaware it could be connected to how well their heart is actually functioning. So if you or someone you love has been feeling a little off lately, and you can't quite explain why, stay with us, because by the end of this video, you may have a much clearer picture of what your body could be trying to tell you. The heart is, in many ways, the quietest, hardworking organ in the body. It beats roughly 100,000 times a day without ever asking for a break, and because it works so consistently in the background, we rarely stop to think about it until something feels different. That's part of what makes early symptoms so tricky to catch. They don't interrupt your day the way a broken bone or a bad flu would. Instead, they show up gradually, blending into the normal wear and tear of daily life, which is exactly why understanding what to look for matters so much. What makes this even more challenging is that the human body is remarkably good at adapting. When circulation becomes slightly less efficient, the body doesn't send out an alarm bell, it simply compensates, quietly rerouting energy, adjusting blood pressure, and prioritizing which organs get the most oxygen in any given moment. This is a survival mechanism that has served humans well for thousands of years. But it also means that by the time a symptom becomes obvious enough to impossible to ignore, the underlying issue may have been developing for quite some time already. That's exactly why learning to notice the subtle version of these signs, rather than waiting for the dramatic version, can be so valuable. Let's start with something almost everyone experiences at some point, but which takes on a different meaning when it happens for no clear reason. Number 1, unusual and persistent fatigue. Feeling tired after a long day at work or a poor night's sleep is completely normal. But there is a different kind of tiredness that some people describe as feeling like their body is moving through wet sand, even during simple, everyday tasks like folding laundry or walking to the mailbox. This type of fatigue happens because when the heart isn't pumping blood as efficiently as it should, the muscles and organs throughout the body receive less oxygen than they need, and the body compensates by redirecting energy away from tasks that feel optional. Margaret, a 68-year-old retired schoolteacher, mentioned to her doctor that she had started needing to sit down halfway through vacuuming her living room, something she never had to do before. She assumed it was simply a sign of getting older. After further evaluation, her doctor found that her heart was not circulating blood as effectively as it once had. What made Margaret's situation especially easy to overlook was that her fatigue never felt dramatic. She wasn't collapsing or gasping, she simply felt like everything took a little more effort than it used to, and she quietly adjusted her routine to accommodate it, taking more breaks, saying no to activities she once enjoyed without ever connecting the dots. This kind of gradual withdrawal from normal life is one of the most common patterns doctors see in patients later diagnosed with heart-related fatigue. It's also worth noting that this type of tiredness tends to be worse in the afternoon and evening, and often does not improve significantly with rest or sleep, which sets it apart from ordinary exhaustion. Fatigue like this is easy to brush aside, especially because it develops gradually rather than all at once, which is exactly why it often goes unnoticed for so long, sometimes for years, before anyone thinks to ask whether the heart might be involved. Number 2, shortness of breath during routine activities. Feeling winded after climbing several flights of stairs is expected. Feeling winded after climbing just one flight, or even while getting dressed in the morning, is a different story. When the heart struggles to pump blood effectively, fluid can begin to build up in and around the lungs, making it harder for oxygen to move where it needs to go. This can create a sensation of breathlessness even during activities that used to feel effortless. Some people notice it first while carrying groceries from the car, others while making the bed. Because this symptom tends to appear slowly, many people unconsciously adjust their daily routines to avoid triggering it rather than recognizing it as something worth mentioning to a doctor. Doctors sometimes refer to this as dyspnea, which is simply the medical term for the sensation of not being able to catch a full breath. What makes it so easy to miss in its early stages is that people naturally begin pacing themselves without even realizing they're doing it. A person who used to walk briskly to the mailbox might start walking a little slower, or someone who used to carry 2 bags of groceries at once might start making 2 trips instead of one, all without consciously thinking, "My breathing has changed." This kind of self-adjustment can mask the symptom from the person experiencing it, even while it's noticeable to a partner or family member who sees the pattern from the outside. If you've caught yourself pausing more often during activities that once felt easy, or if a loved one has commented that you seem to be slowing down, that adjustment itself may be worth paying attention to and worth mentioning at your next checkup. Number 3, swelling in the feet, ankles, or legs. When the heart isn't circulating blood efficiently, blood can back up in the veins, causing fluid to leak into the surrounding tissue, most commonly in the lower legs, ankles, and feet due to gravity. This is known as edema, which simply means fluid retention in body tissue. It often shows up as tightness in socks by the end of the day, or shoes that suddenly feel a size too small. Robert, a 72-year-old man who had always taken pride in his daily evening walks, noticed his ankles looked puffier than usual over the course of a few weeks. He initially attributed it to standing too long in the garden. Robert's family later mentioned that they had noticed the sock marks on his ankles at dinner one evening, deep indentations that stayed visible for several minutes after he removed his socks. This kind of lingering indentation, sometimes called pitting edema, can be a useful clue, because pressing a finger gently into the swollen area and watching whether the indentation slowly fills back in can help distinguish fluid-related swelling from other causes. It's also worth mentioning that this kind of swelling tends to be worse by the end of the day and often improves somewhat overnight, particularly if the legs are elevated during sleep, which is one reason it can be mistaken for simply being on your feet too much. Swelling that develops gradually and doesn't fully go away overnight, especially when paired with other symptoms on this list, may be a sign that fluid is accumulating in ways the body isn't managing well on its own. And this is generally something worth discussing with a healthcare provider rather than waiting to see if it resolves on its own. Number 4, a persistent cough or wheezing that won't go away. A cough that lingers for a week or two after a cold is common, and usually nothing to worry about. But a cough that continues for weeks, particularly one that produces white or pink-tinged mucus, or that worsens when lying down, can sometimes be connected to fluid buildup in the lungs related to how well the heart is functioning. This is sometimes referred to as a cardiac cough, and it can easily be mistaken for allergies, asthma, or a lingering respiratory infection. What makes this sign particularly tricky is that it often responds slightly to cough medicine or allergy treatment, which can create a false sense that the underlying cause has been addressed, when in reality the root issue may lie elsewhere. This overlap with common respiratory conditions is exactly why a cardiac cough can go unrecognized for so long, sometimes even after multiple visits to a doctor for what appears to be a stubborn cold. One clue that sets it apart is the pattern of when it happens. A cough related to fluid buildup around the lungs often worsens specifically when lying flat, and may improve somewhat when sitting upright or propped up on pillows, whereas a typical cold-related cough tends to be more consistent throughout the day regardless of position. Some people also notice a faint wheezing sound when they breathe, similar to what's heard in asthma, which is sometimes referred to informally as cardiac asthma even though it isn't asthma at all. If a cough has persisted for an unusually long time despite treatment, or if it seems to change depending on your position, it may be worth mentioning to a doctor, along with any other symptoms you've been experiencing alongside it. Number 5, irregular, rapid, or pounding heartbeats. Most people have felt their heart race after a scare, too much caffeine, or an intense workout. But some people describe a fluttering or pounding sensation in their chest that happens at rest, seemingly out of nowhere, sometimes lasting only a few seconds and other times persisting for several minutes. This sensation, often called heart palpitations, can be associated with irregular electrical activity in the heart, which in some cases may affect how efficiently it pumps blood. Not every palpitation is a cause for concern, and many people experience them harmlessly throughout their lives, often related to stress, dehydration, or too much caffeine. However, there are certain patterns that tend to raise more concern for doctors. Palpitations that happen frequently, that last for several minutes at a time, or that are accompanied by lightheadedness, chest discomfort, or shortness of breath, are generally taken more seriously than an occasional isolated flutter. Some people describe the sensation as their heart skipping a beat, while others describe it as a rapid fluttering, almost like a bird trying to escape from their chest, and still others notice it as an unusually strong pounding that they can feel in their neck or throat. Keeping a simple record of when these episodes happen, how long they last, and what you were doing at the time can be incredibly useful information to bring to a cardiologist, who can use tools like an electrocardiogram or a wearable heart monitor to better understand what's happening beneath the surface, sometimes even catching an irregular rhythm that wouldn't otherwise show up during a brief office visit. Number 6. Lightheadedness or episodes of dizziness. Feeling briefly dizzy after standing up too quickly happens to almost everyone occasionally. But recurring lightheadedness, especially episodes that happen without an obvious trigger, may be connected to the heart not delivering enough blood flow to the brain. This can happen when the heart's pumping efficiency decreases, or when its rhythm becomes irregular for brief periods. Diane, a 59-year-old nurse who had spent decades caring for other people, initially dismissed her own dizzy spells as simply being related to skipping meals during busy shifts. It wasn't until she experienced a dizzy episode while sitting quietly at home that she decided to get it checked out. Diane later described that moment as a turning point, because until then she had always found a reasonable explanation for each individual episode: low blood sugar, dehydration, standing up too fast. But the fact that it happened while she was simply resting on her couch didn't fit any of her usual explanations. That's often how these symptoms work. Each one on its own seems explainable, but the pattern over time is what tells the real story. While dizziness has many possible causes, ranging from dehydration to inner ear issues to medication side effects, ruling out a cardiovascular cause is often one of the first steps a doctor will take, particularly when the episodes are unpredictable, increasing in frequency, or occurring alongside fatigue, shortness of breath, or palpitations. If you find yourself keeping a mental list of excuses for repeated dizzy spells, it may be worth stepping back and looking at the bigger picture instead. Number 7. Chest discomfort, pressure, or tightness. Chest pain tends to get the most attention, and understandably so, but the discomfort associated with heart trouble does not always feel like sharp, stabbing pain. It's often described instead as a dull pressure, a squeezing sensation, or a heaviness that sits in the center of the chest, sometimes spreading toward the shoulder, arm, neck, or jaw. This discomfort may come and go, particularly during physical activity or emotional stress, and can ease with rest, which sometimes leads people to underestimate its significance. It's important to know that women, older adults, and people with diabetes may experience this symptom differently or more subtly than what is typically portrayed in media, sometimes feeling more like fatigue or nausea than classic chest pain. This difference in presentation has real consequences, because for decades, most public education about heart symptoms was based primarily on how men tend to experience them, which means many women have historically had their symptoms dismissed or misattributed to anxiety or indigestion. A heaviness that feels more like a tight band around the chest, rather than a stabbing pain, still deserves attention. So does discomfort that shows up primarily as upper back pain or a vague sense of pressure that's hard to describe precisely. Any new or unexplained chest discomfort, however mild it may seem, however easy it might be to talk yourself out of, is generally recommended to be evaluated promptly by a medical professional, as early assessment can make a meaningful difference, and it's always better to be evaluated and reassured than to wait and wonder. Number 8. Difficulty breathing while lying flat. Some people find that they sleep better propped up on 2 or 3 pillows without fully understanding why, assuming it's simply more comfortable. In reality, this habit can sometimes develop because lying completely flat allows fluid to redistribute toward the lungs, making breathing more difficult in that position. This is known as orthopnea, and it can also show up as suddenly waking up gasping for air in the middle of the night, a symptom known as paroxysmal nocturnal dyspnea, which simply means a sudden episode of breathlessness that occurs during sleep. Frank, a 64-year-old truck driver, had unknowingly been adding an extra pillow to his bed every few months for over a year before mentioning it to his doctor. He had simply adapted without realizing his sleeping position had quietly become a coping mechanism. Frank's wife later recalled that she had noticed him becoming more restless at night, shifting positions frequently, and occasionally sitting up on the edge of the bed for a few minutes before lying back down, something he had never done before. These small nighttime adjustments often go unnoticed by the person experiencing them, since they're half asleep when they happen, but they can be a meaningful clue when reported by a partner. It's also common for people experiencing this symptom to feel unusually tired during the day, which connects back to the fatigue we discussed earlier, since interrupted or uncomfortable sleep compounds the problem. If you found yourself needing more support to breathe comfortably at night than you used to, or if a partner has mentioned that your sleep looks more restless than it used to, it may be worth bringing up during your next medical appointment, along with a description of exactly how your sleeping habits have changed. Number 9. Sudden or unexplained weight gain. Gaining a pound or two here and there is a normal part of life. But gaining several pounds within just a few days, without any change in diet or activity level, can sometimes indicate that the body is retaining excess fluid rather than accumulating fat. This is closely related to the swelling mentioned earlier in this video and reflects the same underlying process: fluid building up because the heart isn't circulating blood as effectively as it should. Some doctors recommend that individuals with known heart conditions weigh themselves daily at the same time each morning, because a rapid increase, such as 3 or more pounds in a single day, can serve as an early warning sign that fluid is accumulating faster than expected. This kind of tracking might sound overly cautious for someone who hasn't been diagnosed with a heart condition, but it can also serve as a useful early habit for anyone who has noticed other symptoms on this list. The key distinction to look for is the speed of the change. Weight gained gradually over weeks or months, in the context of diet and lifestyle, is a very different pattern from weight gained rapidly over just a few days, which is far more likely to reflect fluid retention than fat accumulation. Clothing and rings can sometimes offer an early clue as well. A wedding ring that suddenly feels tight, or pants that no longer fit comfortably around the waist despite no change in eating habits, are worth paying attention to. Tracking this kind of pattern, even informally using nothing more than a notepad or a phone app, can provide valuable information to share with a healthcare provider, and may help catch a developing issue before it becomes more serious. Number 10. Loss of appetite, nausea, or a feeling of fullness. This may be the most surprising sign on this list, largely because it doesn't seem related to the heart at all. When circulation becomes less efficient, blood flow to the digestive system can decrease, and fluid can also build up around the liver and intestines. Together, these changes can create a sensation of fullness after eating only a small amount, ongoing nausea, or a general disinterest in food that wasn't present before. Because this symptom overlaps so closely with common digestive issues, it is frequently misattributed to diet, stress, or minor stomach bugs, and it's often one of the last signs people think to connect back to their heart. This connection is one that even some patients find hard to believe at first, because the heart and the stomach feel like completely unrelated parts of the body. But the circulatory system touches every organ, including the digestive tract, and when blood flow to the gut is reduced, digestion itself can become noticeably less efficient. Some people describe feeling full after just a few bites. Others notice a persistent low-grade nausea that doesn't clearly relate to anything they've eaten. And some simply find that food has become less appealing than it used to be, without being able to explain exactly why. This can also lead to unintentional weight loss over time, which stands in interesting contrast to the fluid-related weight gain discussed in the previous sign, illustrating just how many different and sometimes contradictory ways the body can respond when the heart isn't working as efficiently as it should. Recognizing this connection matters because a noticeable and unexplained change in appetite, particularly when it appears alongside any of the other signs we've discussed today, can be a meaningful piece of a much larger picture. Taken individually, many of these signs can seem minor, easy to explain away, or simply a normal part of getting older. But research has shown that heart failure affects more than 6 million adults in the United States alone, and a significant number of those cases were preceded by subtle symptoms that went unrecognized for months before a diagnosis was made. That statistic matters because it tells us something important. Early recognition genuinely does make a difference, and understanding your own body is one of the most powerful tools you have. It's also worth remembering that these 10 signs rarely appear in isolation, and they don't always follow a predictable order. Some people notice fatigue first, others notice swelling, and still others are caught off guard by something as unexpected as a change in appetite. What tends to matter most, according to many cardiologists, is not any single symptom in isolation, but rather a pattern of several small changes accumulating over time, changes that on their own might each seem forgettable, but together tell a more complete story. Paying attention to that bigger picture, rather than waiting for one dramatic moment, is often what allows a condition to be caught and managed early, when treatment tends to be most effective. None of this is meant to cause alarm, and experiencing one of these signs occasionally does not necessarily mean something is wrong. Fatigue, dizziness, and even occasional shortness of breath happen to healthy people too, and there are many possible explanations that have nothing to do with the heart at all. But if several of these symptoms sound familiar, or if you've noticed a pattern developing over recent weeks or months, it may be worth having an open conversation with a healthcare professional who can properly assess what's going on, ask the right questions, and order the appropriate tests if needed. Trust the small signals your body sends you. They are often trying to tell you something long before a bigger problem develops. And listening early is almost always easier than dealing with the consequences of waiting too long. If this video helped you understand your body a little better, we'd love to hear from you. Which of these 10 signs surprised you the most, and have you or someone you know experienced any of them? Let us know in the comments below. We read every single one, and your experience might help someone else watching recognize something in themselves or a loved one. And if you found this information valuable, consider sharing it with someone who might need to hear it today. A parent, a grandparent, or simply a friend who's been feeling a little off lately. Consider subscribing for more clear, honest, and carefully researched health content delivered the way it should be, without exaggeration and without unnecessary fear. Thank you for watching, and take care of that heart of yours. It's the only one you've got.